group. And I welcome all of you this afternoon for what we expect will be an engaging, informative session. And perhaps what drove you to register for our program is because you saw DE&I on our flyer. And that may be a way to get started, but we expect today to go much deeper than DEI and really to take you on an anti-racism journey, a racial equity journey. So we have several speakers who have been working in this field for quite a while. And first you'll hear from Karen Norman. And by the way, you should have received all of their bios this morning. I do not plan on reading the bios because we could eat up quite a bit of time doing that. So if you haven't read the bios, they're linked in the chat. I encourage you to do so now. But first we'll hear from Karen Norman, who's the Chief Program Officer at Lutheran Social Services of New York. Next we'll hear from Dr. Stephen Itzkowitz, who's a professor of medicine, oncological sciences and medical education, and director of the GI Fellowship Program at Icahn School of Medicine at Mount Sinai. Then we'll hear from David Peters, who's a social worker and a community advocate, and he'll speak about New Rochelle Against New Roar, which is a community program. And then we'll hear from Cindy Carnegie Collins, who, like David, is a social worker, but she's also a trainer, a consultant, and a licensed social worker, but she'll speak today about consulting and how she helps to get organizations and individuals started on the racial equity journey. So first we'll hear from Karen, and I would encourage all of you who have questions to put them in the chat so that we can hear from our speakers, and we'll try to get to those at the end of the program. So Karen, and as I said, please check her bio in the chat, but Karen has an extensive background in clinical social work, leadership programs in human services, and she's going to speak about her experience in government and also in a nonprofit organization. So with that, I'll turn it over to Karen.
So thank you so much, and good afternoon, everyone. I'm excited to be here this afternoon, and so many of my colleagues on the panel are people who I actually started my journey as an anti-racist activist with. So it's exciting. It feels like a family reunion of sorts. I don't want to talk a lot about my bio, but I think there's a couple of things that whenever you begin to do anti-racist work, you must do, and that you must present who you are in the room. And I think it levels it off and people understand you better. So I always tell this story about being a Bronx girl, born and bred, the daughter of an immigrant, Caribbean immigrant mother and a Southern African-American dad. And I think it's important to say that because it colors the lens with which I see the world. So I always talk about being born a South Bronx kid, and my journey in the world is colored by my perspectives, what I saw and what I've come to know. So as we talk about a journey in anti-racist work, I want to ground it by saying I've been in Philadelphia for much longer than I even want to talk about these days. The numbers add up because I started in 1989 as a caseworker for Child Welfare Administration, which is formerly known as, which is currently known as ACS, Children's Services. And they had just rebranded themselves from being BCW, which is the Bureau of Child Welfare. And so for those of you who date back as far as I do, you may remember all of those acronyms. And why it's important is because at the time, I started as a brand new, shiny caseworker right out of college with a perspective of having lived in the Bronx my entire life, but also experiencing the world as a Black young woman. And I continue to experience the world in that way, maybe not so young now, but I think it helped to contextualize how I came to do the work that I do. I knew during the time that I began working, it was the height of the crack epidemic, and what I was seeing was horrendous. But I had a socialized perspective at the time, which really centered around this idea that people were potentially locked or ostensibly locked in their poverty and in their experience because of something that they were doing or not doing. And that has really increased in my understanding of racism. I remember being uncomfortable with things that happened as a young woman and always wondering why the stereotypes of Black people being lazy when you couldn't even get a seat on the bus or the train with so many of us going to work. It didn't jive, it didn't make sense. And I had that in my head, but I also held in my head these ideas around bootstraps. That's the message that you're given, right? That's the acceptable message that if you work really hard, if you study hard, if you get yourself into the right schools, that doesn't have to be your life. So I started my journey as a caseworker with these opposing ideas in my head and not completely making sense of what I was seeing, but knowing that I was really deeply and profoundly hurt at the idea of people that look just like me suffering to the extent that they were suffering in poverty, but also trapped in the dynamic of substance abuse. I moved up the ladder in child welfare, and that's great. I learned a lot through experience that I then went to graduate school, and you get the theoretical practice around what it is you kind of already knew. But things that I didn't know and really were awakened by was a call from the New York State Office of Children and Family Services that as a child welfare leader, I take a look at the disproportionate minority representation in foster care. And at the time this came about was, I think, 2012 or 2013 when we started out. And I felt I had a responsibility to take a look. I want to say that I am naturally curious and really wanted to understand, because now you're not a caseworker just following rules. You're a leader of caseworkers following rules, practices, and procedures, but perhaps we need a deeper dive into understanding why so many Black and Brown children were in foster care at such a disproportionate rate. And I want to also round that off by telling you that personally, what was happening for me, it was a period of time when my mother was really sick and had been diagnosed with colorectal cancer. So I'm glad we have a doctor on who's an expert. And one of the things I quickly knew was that she would never be able to see a doctor without one of me, my sister or I being present, because we wanted to make sure that the doctor understood that my mother was not a quote unquote stereotype and that she had educated people around who were going to advocate for her and to help her to get all of the benefits and services that she needs. So I juxtaposition that because it also frames how I began to see myself as a leader and my responsibility. And my responsibility was really to examine the decisions that we were making around children being in foster care and why it was happening. So all of this is going on, and I think it's important to talk about the journey that someone is having and the revelations that happen. Around about that time, Denise Gordine, who's one of the promoters of this particular plenary, and I took the Undoing Racism workshop. And that opened up so much for me because it helped me to really begin to think differently that no, maybe this is by design and not necessarily the fault of people not working as hard as they could or doing what they needed to do. This understanding of why poor people are poor, this understanding of why these things were happening in certain communities at a disproportionate rate to other communities. And I think that also actual events that happened, like a case that we came across, two cases in Westchester County, and we call it Home Alone 1 and Home Alone 2. And in Home Alone 1, it was white children who had been left at school age, or small white children who had been left alone at home in a socioeconomically thriving community, right? So middle class community, and how the police responded. And then children who had been left alone in the Black community in Yonkers, where I was a leader, and how the police responded. In both incidents, we have children being left alone by reasons that their parents gave. But we know that with the white children who had been left alone, the police stayed in the house and babysat the children and stayed for hours until they got in contact with the parents and then made other arrangements because these parents had gone on vacation and left their kids to fend for themselves with food in the house. In the other instance, this young Black mother had gone out to the store and thought that her children were asleep and they would be okay until she got back. And she was arrested upon arriving back at home. The white parents were never arrested. And you don't account for that by saying, oh, well, she didn't go to school, she didn't study hard enough, she didn't work hard enough. How do you account for those kinds of practices that were embedded? And how do we account for this idea that we allow things like that to happen and just go, yeah, that's kind of the way it is? So the Undoing Racism workshop, I think for me, it woke up something inside of me. I've always been a chatterbox. I've always been a griot, so I can tell a story with the best of them. I've always been fearless in my defense of things that I thought were unjust. But now I was just positioning that with what am I doing as a leader? It led me into conversations with other leaders in child welfare, Denise Gordine being one, Raina Arias, Yizer being another, and Michael Orth, who I credit a lot of it to. And I believe he's still a commissioner with Westchester County's community mental health services, who is a white ally. And I learned very quickly, because I'm trying to weave in the lessons we're supposed to get out of all of this in my 10 minutes. I needed a white ally, not because I didn't think that I could be a fierce advocate for right or wrong for people of color, but because I also understand systems. I also understand how things work. And I also understood that at some level, when we try to dismantle racism, we have to have the joining of white allies in the conversation. So, what was really, I think, life changing was to be able to have conversations with colleagues where we were addressing the elephant in the room, where we were actually talking about what were the differences in Home Alone 1 and Home Alone 2, and why those injustices angered us to our core, but also what could we as child welfare leaders do differently? Now, I think one of the things that OCFS at the time, who was working with us on disproportionate minority representation, didn't want to take on completely was this idea of racism, was this idea that inherent in our very practice, the way we assess for safety, the way we thought about how we did child welfare removals was bias, be it unconscious or conscious bias. There was some, I think, racist thought around why things happen to certain people and not others, and not enough action around how we needed to do it differently. So what we needed to do was really to begin to look at our rates of recidivism. Why Black and Brown children who, if they did finally leave foster care, why are we so quick to bring them back? And those were difficult conversations that I thought, in order for us to really, really have in a robust way, we needed to have a frame to talk about them with. So we needed a frame that the People's Institute for Survival and Beyond was able to give us through having the Undoing Racism workshops. So I think one of the biggest fights that I've ever had to deal with, and it was an intellectual battle, it was a battle of will. I think it was, I'm a spiritual woman, it was a battle of spirit, was this idea that we were going to get the Westchester County Board of Legislators to not only sanction, but to pay for Undoing Racism workshops for all of the staff in child welfare at the time. And subsequently, we were successful because I didn't do it alone. I did it with a group of people who sat around and thought long and hard about how we do this. And so one of the things I had to do was really to look at the language at the time. Robert Astorino was the executive at the time, and Barack Obama was the president at the time. And so those two ideologies don't necessarily go together when you think about the point of view and the point of reference that they're coming from. And so what was kind of painful, but we got through it, was really to talk about child welfare in the ways in which Astorino at the time was talking about child welfare. And at the time he was talking about the drain on the economy of the poor taxpayers of Westchester County because they had to spend this kind of money on social services for people who were not pulling their weight or, pulling themselves up by their bootstraps. And if you remember, I started this conversation by telling you that I was socialized in thinking that people who are poor, people who are not achieving and carrying and getting on that American dream might possibly be part of the reason why it was their lack of what? Energy or devotion to it that was causing it, without thinking about all these other causal factors that had to do with racism, that had to do with the legacy of slavery and things that have happened and redlining and redistricting and all of these things that we come to know now. And I'm happy to say are more prevalently spoken about on the news. If you watch anything other than Fox 5, if you happen to turn on MSNBC or CNN, there's a lot more progressive conversation about how we're impacted by systems. And one of the ones that I know I needed to work on at the time was child welfare. But then the other one was also the medical system. Because at the same time that I wanted to and was engaged in this fight around how we begin to look at families differently, I also had to think about it for my own family. I wanted to get through more. Okay, I am out of time, and I am going to turn it back to Colleen.
Thank you, Karen. Really
Thank you.
appreciate hearing your story. I think one of the things that you'll hear repeatedly from each of our presenters is that they all took the Undoing Racism workshop, which was the foundation that enabled them to think differently about the work they were doing. And so you heard from Karen about what that meant for her working in a government situation. And then she's carried that work on into the nonprofit sector. Now we're going to hear from Dr. Itzkowitz, who is a representative of a large private, I guess, public-private organization. And while he was in that massive bureaucracy, he also, as an individual, made great headway in getting racial equity work into Mount Sinai. And so we'll hear from Dr. Itzkowitz now.
Thank you so much, Colleen, and thank you for the organizers for inviting me. In the time allotted, I just want to mention that, you know, the comments that I make are my own. I'm not officially representing Mount Sinai or the Icahn School of Medicine or any lay or professional organization that I may belong to. And I am a member of NUROR, and you'll hear from David Peters in a moment. And I want to lift up and honor some of my teachers who are on the call, particularly Marjorie Freeman. So my comments, I'll divide them up at the institutional level, the departmental level, and then my own personal level. So, and I'd like to just share a couple of slides with you, which might make some points a little bit more clear. So can you all see this slide?
Yep.
At the institutional level, Mount Sinai has really ramped up its efforts to become an anti-racist institution, particularly so since George Floyd's murder, although it even predates by several years. And there is a very robust, multi-pronged, all-around effort to try to address racism, and we call that the roadmap for action. This is a roadmap that's divided into 11 strategies, and I know that the font is small, I'm not expecting you to read it, but the strategies, you know, we have measurements, we have efforts around healthcare delivery. In some of our clinics, we have segregated care, where depending upon your insurance, you may see a different level of doctors. That's trying to be fixed, although it's not there yet. There's community engagement. There's development around financial investment in equity and anti-racism. There's efforts to recruit Black and other individuals. And of course, being a medical school, an anti-racist education environment. I'm going to leave the slide up while I make some other comments in case you want to read more. But so there is an institution-wide effort, although we're still actively working on this. Now, I work in the Department of Medicine, and the chair of our department has paid for anybody in the department to do the Undoing Racism workshop for the last several years. So that doesn't become a barrier to anyone who would like to do it. And not only that, but I'm on the DEI committee for my department, and about 80 or 90% of the members of that committee have taken the workshop and apply the principles in our work. And our work in the department is to really recruit residents and fellows. That is, those are trainees just after medical school who represent the diversity of our community. And we have very intentional processes for that. We actually have happy hours where we invite applicants who are underrepresented in medicine. You may have heard the term URM, which the old term is underrepresented minorities, but we changed that to URIM, underrepresented in medicine. And so we have happy hours to try to recruit people. We have a program for early acceptance into residency so that people can actually get accepted into our residencies a year before other people might be applying, to give them a leg up. And we even have priorities for URIMs who can do electives here as students so that they get to see the environment and the culture of Mount Sinai before they even apply for residency programs. Now, at a personal level, you know, as a medical doctor, a researcher, and an educator, you know, I have a career that really affords me many privileges. And I'm trying to leverage that privilege as a white male physician. And the work that I've done to educate and train myself as an active anti-racist has really guided me to become a liberated gatekeeper. And in my role in academic medicine, I have several constituents that I feel accountable to, and I'm intentionally accountable to them. So one of my constituents, of course, are my patients. I have a practice, I see patients, and of course, I'm very accountable to them, and I try to deliver the very best care. But another thing that I'm very proud of is that the work that I've done in the last 20 years surrounds a public health intervention around increasing screening colonoscopies in New York City. And let me just share with you, I'll turn to the next slide in just a second. But 20 years ago, it was about 3 years after screening colonoscopy was suggested to be a screening device. Colonoscopy used to be a diagnostic tool. It became a screening tool in 1997. And then in 2000, there were guidelines that said people should get colonoscopies. But we knew that in East Harlem, Blacks and Latinx individuals were woefully underscreened. And of course, the rates of colon cancer were higher and the deaths from colon cancer were higher. So I hired a brilliant behavioral scientist named Lena Jandorf, and we started a program at Mount Sinai in East Harlem to test the effect of patient navigation. A patient navigator at that time, 20 years ago, that whole concept was developed by Harold Freeman, who was a Black surgeon at Harlem Hospital, because he saw a lot of Black women in Harlem who had abnormal mammograms, but never got in for biopsies because it was too complicated for them. So he developed these health educators to try to get women with abnormal mammograms in for biopsies. And Lena and I decided, well, why don't we use patient navigation to get people in for a screening exam in the first place, i.e. colonoscopy. We got funding from the NIH to look at the Black community and the Latinx community. And needless to say, we demonstrated in a matter of a couple of years that we can increase screening colonoscopy rates. We can reduce the no-show rates. We can improve bowel preps. And not only that, the whole thing was financially profitable. It wasn't even break even. It was actually profitable because more people were showing up. At around the same time, New York City was looking at patient navigation as well. And the Department of Health had an interest in increasing screening colonoscopy rates across New York City. And we organized a coalition of every hospital in New York City back in 2003. We call ourselves the C5 Coalition. It's the New York City-wide Colorectal Cancer Control Coalition. And what you see is in 2003, when we started, screening colonoscopy rates in all demographics was at 42%. Now compare that to 80% amongst women that were getting mammograms and pap smears. So the same women that were going for pap smears and mammograms were not getting colonoscopies. And we decided as a city that we wanted to raise the rate to 60% by the year 2008. Well, as you see from this graph, we actually got close to 60% a couple of years ahead of ourselves. And what you see in this citywide effort, every hospital just did what it could to increase screening colonoscopy rates. And we're now screening at around 70%. But what we're most proud about is the next slide, and this is my last slide. And that is that we've eliminated, except for Asians, we've eliminated the disparities by race and ethnicity. So back in 2003, needless to say, white people were screened more than Blacks and Hispanics and Asians. And through all of our efforts, within a couple of short years, the rates amongst whites, Blacks, and Hispanics have really been superimposable for all of these years. The Asian community takes occasional work to try to bring their rates up. But I think what you can see is that where there's a will, there's a way. And as a city, we were able to accomplish a lot of parity for screening colonoscopies. And this has saved a lot of lives. The last couple of comments I'll make is that, you know, one of my hats is I run the fellowship training program, which trains gastroenterologists. And years ago, we used to just take people from the Ivy League programs. But because I started doing the Undoing Racism workshop about 10 years ago, it opened my eyes to really look at every applicant. And now we look at every single applicant that applies to our program. And in fact, I'm leaning more towards getting people who really come from underserved areas because they're highly motivated. They don't take anything for granted, and they're incredibly creative and smart. And it's greatly enriched our own program. In fact, we took someone who was from Trinidad, who was training at Downstate. We took her into our program. She was shocked that we even looked at her application. Her goal was to actually train in the United States because there was no GI fellowship in Trinidad to this day. And her goal was to come here, train to be a gastroenterologist, and then go back down to Trinidad and develop a GI training program. And she's going to do it. She's almost done with our training program. The last thing I'll just comment on is that I've brought the Undoing Racism workshop to Mount Sinai, I think about 10 times now in the last 6 years, about 2 or 3 times a year. And I do this because I really believe that it's the most effective way by which people can learn to become anti-racists. We just did a workshop, now they're on Zoom. And that's, again, one of the reasons why I'm leveraging my privilege to try to enhance the education of students, fellows, residents, and faculty. So I think I'll stop there in the interest of time. And if there's any questions, I'm happy to answer them.
Great. Thank you, Dr. Iskowitz. I think you will have noticed a few things by now, both from Karen and from Dr. Iskowitz, the role of having data in order to measure progress. And I think that's really essential. And of course, you heard from Dr. Iskowitz again about the value of having that foundational work through the Undoing Racism workshop. So we've heard from 2 people who represent institutions. And now we're going to hear from David Peters, who's going to talk about what individuals can do in their communities. So David, I know you've got an extensive background, a great resume, and again, I encourage you to read it. He's like Cindy and Karen, he's a social worker, a longtime community advocate, and he's doing great things in New Rochelle, right here in Westchester. So take it away, David. You're muted.
Thank you. Thank you for the introduction, and thank you to the 2 previous panelists who I'm very close with, and we have a kinship in many ways in this particular work, and in many ways in this particular effort to undo and interrupt and disrupt racism. I'm here today to talk more about really what we've been able to do on the community level. And so although I'm familiar with the institutional side of what it means to be involved in race and racism and undoing it, what I'd like to talk a little bit about is our experiences as a resident group in New Rochelle. And what I mean by that, and starting out, I have to first say that New Rochelle Against Racism, about 8 years ago. But what many people, even in New Rochelle, were not aware of is that maybe 2 to 3 years before, the organizing on the ground, based upon living in a city as New Rochelle, such as New Rochelle, had a philosophy and a way of conducting its civic life and the life of its residents, in which New Rochelle framed itself as a community that was multiracial, multicultural, multi-generational, and that the cultural diversity was the reason for why people came and stayed in the city of New Rochelle. And all of that is true. What is also true is that New Rochelle has a history associated with race and racism that is deeply rooted historically within the city of New Rochelle. So much so that there were landmark federal cases that went to the Supreme Court in the areas of education and in the areas of ensuring that there would be representation for a city council for the Black population, and needed to go to court in order to make that happen. So I'm saying that to say that our engagement and our involvement was based on, as has just been mentioned, on understanding data. But the data that we were understanding and paying a lot of attention to was the qualitative data around how people's lives, particularly people who had generationally found themselves to be financially poor, or generationally found themselves locked into a way of life in which they really were not able to have the same access within the systems and institutions that others have had. And so what occurred prior to us forming New Roar was that there were individuals, when we decided to come together, who had responsibility for certain places and spaces that were part of the culture and traditions of the Black community. And so with respect to that, I just want to lift up in my time, who has passed on, Pastor DeQuincy Hentz. I want to lift up Pastor Weaver, Elder Adamson, Pastor Rouse, Pastor Welby, Reverend Dawkins, Steve Horton from Municipal Housing, council person at that particular time, and now Judge Rice, Dr. Angela Campbell, Mr. Ron Williams, President, Executive Director, formerly of the NAACP, the Executive Director from the Boys and Girls Club, at that particular time it was Quay, Vera Cheeks from New Rochelle High School, Mrs. Dorsett from New Rochelle High School, Dr. Gomez from New Rochelle High School. Prior to New Rochelle Against Racism being formed, all of these individuals participated in what we call the Community Enrichment Zone. And our reason for organizing is that we recognized that within our traditions, we were fragmented in many ways and doing the same things and not impacting the community that we all loved and existed in as we had hoped to do. I also don't want to leave off Pastor Holder as well. And so we came together. And in coming together, we began to move forward with a collective agenda in which those who had responsibility for the places, whether churches or others, would be the ones who would attend our meetings. So we wanted to make sure that the leadership of these particular institutions would not necessarily be able to send an envoy or send someone else in their place, but that we wanted to make sure that they were all present along the way. Somewhere along the line in my history, similar to others on this panel, I was introduced to Undoing Racism training. And so I also want to lift up in this timeline that it was at that point in time where in coming through the community organizing that I was able to, or we were able to, also bring forth into our room without any money being involved, no funding along the lines of Ron Chisholm, Dr. Kimberly Richards as well. And they would come and we would have discussions and we would have dialogue. Somewhere along the line, I also needed to, or we needed to, begin to try to see how we could work effectively together, because we had long histories of leadership within our community that kind of worked within their separate silos. And so we also brought in at that time another person who had been exposed to and was a friend of mine of the Undoing Racism training, Dr. Willie Tolliver, to help support our engagement along the way. New Roar emerged when the Anti-Racist Alliance of Westchester, we decided that a book that we were going to read at that particular time was a book read that pulled all of us together in New Rochelle. And in looking at that book and in reading that book, resonance began to come out. And one of the things that I could say and will say is that if you're in any particular community, it's really important to understand that there are many, many people who are concerned about racism and race, but don't have a place to go. Don't necessarily find people talking about it all the time. Well, what happened with New Roar, to my surprise, what emerged out of that was that after we completed reading, having this particular book read, that people did not want to stop coming. And so 8 years later, we've been meeting for every Monday night. I can't get people not to come out every week to begin to organize and to learn. Now, what I want to say most about this is what grounded us in our coming together: white, Black, Christian, Muslim, Jewish, non-religiously affiliated, poor, not so poor, some wealthy. What grounded us were the principles of the People's Institute for Survival and Beyond. What grounded us was the contract associated with the People's Institute of Survival and Beyond. We recognize that people come into the room with many different worldviews. But what we learned through the utilization of these principles and the implementation of the contract was that allowed us to work effectively together. And so we spent a lot of time organizing around leadership development. And so each and every time that we were together, we became engaged in that particular aspect of our work as a community. And it began to focus us on other areas, such as creating a net that works within the city of New Rochelle. And we began to expand our outreach to build our base so that we could become more effective around the areas of the analysis that we were engaged in. Now, I have to say that there were really good times that we've had, and there were times where tension became a part of our work. Part of what we learned through these principles is that the tension was to be expected and embraced, because we also learned that what we bring to the table is the value and the fact of internalized racial oppression. So when you bring people together, that shows up as well. And so what showed up in our room were those who were immersed in internalized racial superiority, and what showed up in our room were those who were immersed in internalized racial inferiority. And that was when we began to go to work. And so 8 years later, part of what we've learned is that we began to attempt to impact the city of New Rochelle and its institutions by removing cultural diversity as a value for thinking about the city of New Rochelle, and replacing it with the idea that race and racism was the single most greatest barrier for social change and transformation, and that we were no longer really interested in the historical transactional relationships that did not improve the conditions on the ground. One of the things that we talk a lot about collectively as a group, which again emerged from our involvement and engagement with the Institute, is that people do not suffer from a lack of services, that the conditions in which people live, both historically and continuing within the current realities, have to do with a lack of power. So our focus is real clear. Our focus is on working in an accountable way in which we can begin to leverage with the impact of the community and the community members a sense of their own power, so that their lives are in their own hands and not in the hands of a historical relationship that has up to this point always functioned in a way where the conditions on the ground generationally remain the same. So what does that mean? It means that any and everyone who's involved at New Roar, that they need to participate in a workshop, because the leaders of our committees associated with organizing must have that analysis in order for us to move forward. And in relationship to ourselves, we spend time with the second part of our principles around culture. We share culture every time that we come together. We share a way of life, simply as we've come to understand what culture means to us. And we utilize that to ground us in our understanding of each other, so that we can become more effective as we move along the way. So I want to thank you for having this time. I just saw a message. I believe I might be out of time. I don't know. But given that a message popped up, I'll stop now, and hopefully we'll be open for questions as we continue to move along. Thank
Absolutely,
you.
David. Thank you. Thank you so much. And I think it speaks to the power of having committed individuals, that New Roar has existed for 8 years, long before George Floyd was murdered. So that's quite a testament. And we look forward to hearing a little bit more from you about what specific actions are underway with New Roar right now. But I'm going to turn it.
Have I taken up most of my time, or do I have some time to still do that?
After Cindy speaks.
Okay, thank you.
Yeah. So with us to bring us home is Cindy Carnegie Collins. And as I mentioned, she's a social worker like David and like Karen, but she's also a consultant, and that's the role that she's going to speak to today, how she works with organizations to get them going on this journey and getting them along the journey, because as we've heard from David, it's more than just starting. You have to stick with it in order to make progress. So Cindy, tell us about what some of your work is like, and what you have observed in working with different organizations and individuals, and what keeps them along the path.
Thanks so much, Colleen. My name is Cindy Carnegie Collins, and it's interesting because when I was asked to do this, the reason I agreed to it especially was because of the panelists. We all of us here have a long relationship and a long history. That organizing in New Rochelle that David talked about, one of the pieces of that puzzle that was also kind of inclusive to the movement across Westchester County was some of the youth organizing that David organized and was supported by the People's Institute that came out of New Rochelle. That work was to train and to facilitate undoing racism workshops for over 250 young people in New Rochelle across Westchester County, young people that were both engaged in institutions. Some of our organizations who are here on this call, the Children's Village, sent some of their young people to become youth leaders, and a subsequent youth group that ran for about 2.5 years after that. So I want to lift that organizing that David did as well in New Rochelle. And obviously, the work that Karen Norman did in Westchester County was foundational to many of our nonprofits and other organizations really understanding their anti-racist journey. It's interesting because I'm a little bit uncomfortable talking from the role of a consultant, because what I think my better perspective is speaking from someone who's been engaged and dedicated to the work of undoing racism and ending racism in our lifetime. And I think that's the lens I'm going to talk about, my personal journey and sort of the skill set that I think organizations need to develop in order to stay in this work for a long time. I'll start by saying there's two pieces to an anti-racist journey, right? One is the commitment of the individuals who are engaged in whether or not that's the organizing or the implementation of the work. But more importantly than that, it's to get really clear about why we want to do this, right? So we have so many folks on this call right now, and I see so many names that I'm familiar with, including Han, who shouted me out a couple minutes ago. Hey, Han, what's going on? Who's part of the People's Institute for Survival and Beyond. Folks who have been engaged in not just institutional organizing, but community organizing. And I want to get really clear that the first step to this process for any organization is to understand what your motivation is. And so I'll kind of walk it back to what began my process. And so Marjorie Freeman's on this call. I don't know if David Billings is also here, but David Billings invited me to stay in a workshop that I stumbled into it when I was at NYU as a student over 16 years ago now. Changed my entire life course. That was the Undoing Racism workshop. And what you'll hear as a thread for all of us is that we came through this anti-racist journey by first having a foundational understanding that rocked our world. Anti-racism has become something that has entered our common dialogue. I didn't think 10 years ago or even 5 years ago that I would hear so many folks on our national news media talking about anti-racism, whether it's in a controversial way or just a sort of a normalizing way. And what starts us on that process is really understanding what it is that we're talking about. And at the foundation of any anti-racist journey is this idea that we want to restore our humanity and return to human solidarity. That is really what the goal of our movement is, right? Is to really understand where our organizations have gone wrong with regards to things like disproportionality, right? Disproportionate minority representation is what it used to be called. And just generally how our institutions will act in a way to disenfranchise some and lift others. And so I would say the first step of this journey is really to get clear about that and to really understand what anti-racism is. And again, in my definition, it's a return to humanity and our natural sort of state of being of human solidarity with each other so that folks have equitable and equal access to the life that we all deserve. For organizations in particular, though, as you're starting your journey, there are some key sort of steps that we have to take to really understand how ready our organization is for change. And I want to highlight this idea that David kind of introduced, which is that diversity is not a strategy towards addressing disproportionality. So I want to say that again. The diversity is not necessarily a strategy, but what we would call an outcome measure. So your organization is getting healthy when we have diversity of both the employees, of the folks that we serve, and that people stay, and that we can define metrics of wellness for our organization. So what does it mean for our organization to be operating in an equitable and healthy way? And so that would be the first step, is to really think about whether or not you really want to do anti-racism or diversity, because once again, diversity is not a strategy, right? We know we're doing well when our organization is diverse in thought, diverse in people, and diverse in perspective, right? And that those folks stay, and that there's indicators of wellness for those folks too, right? How well are folks doing in our organization? We have to evaluate whether our organizations have the structures to support culture change, right? And have enough culture change to support the structure. So it's a cyclical sort of this circular idea of understanding our organization. So do our organizations have the structures in place to support culture change? That's a really important question when it comes to an anti-racist movement in any organization. Because without those structures, there's nothing to reinforce the new parameters of how we're going to behave in organizations, right? How we're going to be with each other, be with our clients, right? How we're going to service folks. And that if there's not enough culture carriers who really believe in the work, those structures will not be able to be sustained in the long term. You can put as many policies and practices in place, but the next time the leadership changes, those policies and practices are going to go right back. And so sometimes we forget as we're doing this work, because we have become so academic with the way that we think about anti-racism in organizations, that it's just about policy change. It can't just be about policy change. It has to be about policy change, but not solely. And we're not going to policy change away racism in organizations, that there has to also be a culture shift. And that requires us to really look at our organizations in ways that identify who our change agents are. Really clear that CEOs are very, very rarely the drivers of culture change in an organization solely, right? They can bring out the best in organizations or bring out the worst in organizations, right? And they can nurture some of that leadership, but they're not the sole cause of culture change. That actually comes from the folks who are embedded in organizations. And so, for example, that can be anybody. That could be your porter at your site. That could be your maintenance worker. That could be in organizations, social service organizations. Those can be social workers. They can be leadership, of course. But there are pockets of folks who are really those folks who are going to be the culture carriers for their organizations moving forward. We have to understand the history of our organization. And when we say history, we talk about that history deeply. We're not just talking about like, how is our organization founded? How is our organization founded, for who, by who, and for what purpose, right? And potentially, your organization, was intended to serve a very specific population originally. And so all policies and practices, just like any institution, were built in the interest of serving that specific community. We have to really understand that, because if we're asking our organization to change and shift in really radical ways, we have to be clear about where we came from first. And so these are some, examples of places that you would start in your organization. But what I would say is the most important place to jump off of, the foundational, component of any change work, any anti-racist change work for an organization, is really to get a lay of the land. And sometimes that means going slow. It's this idea that we want to hurry, but not rush, right? So we want to be quick in terms of creating change, but we don't want to rush, because as we rush, we don't have a lay of the land. We tend to make a lot of mistakes, and our mistakes will ultimately impact those folks who live on the margins of society and the margins of our organizations. Almost always folks of color who also are LGBTQ, trans folks of color, women, Black and brown women, are impacted disproportionately, even within an organization as it's trying to shift and change, right? The backlash really hits folks differently, all right? And so as we're thinking about this process, we have to be really, really intentional about the places that we start. And what my experience has been in organizations, that the most important, component of this, like getting the lay of the land, is this process of listening. Data collection is so important, right? And when we're talking about quantifiable data, right? Numbers, right? How our organization is represented by the numbers is really, really important. But more importantly, and countercultural to white culture and white institutional culture in particular, is to be able to listen to the stories that we're hearing from our employees, from those folks we work with, right? Needs to be led by the voices of folks of color, meaning we need to listen first and foremost to the folks most affected. But white folks have a story too in organizations. And sometimes it's really hard for us to hear those, because oftentimes those voices and those stories are counter to what we're trying to create, but they're also super important to listen to. Relationship building. Relationship and coalition building has to occur, and it has to occur before any real structural, right, or culture change can occur. Those relationships, as Karen talked about, allyship, right? I want to go even a step further from allyship, and I want to challenge folks here to really think about the quality of your relationships with people in your organization. If you're trying to make change, you're not going to do it by yourself. The quality of relationship has to move from transactional to transformational. It has to move from what I can do for you and what I can produce for you to what I can be for you, right? Meaning that relationship has to be centered. Again, very, very, very different than what we're taught in organizations, right? We're taught very often in organizations, white organizational culture tells us about counting and measuring. It's about what we can produce. We want to challenge that your relationships with each other has to be about what you can be for each other and to each other. And that is very challenging when you're trying to do cross-racial relationships. So we really want to push this idea that allyship, co-conspiratorship, and that the quality of your relationships matter. And so, you know, I don't think I have a lot more time, but I'll take one more minute and then I'm going to give David some time, because I think David had something else he wanted to say, and I don't want to take up your time, David, but, you know, I want to challenge each of you to throw in the chat right now one sort of place that you think that you can make an impact in your organization today. It could be anything. It could be something from reaching out to a colleague that you know is interested in doing this work, to, you know, forming an outside group of a small group of employees or folks that you know that you want to do a book reading to. But I want you to throw in the chat one place that you feel like you can really influence today in your organization that could impact your long-term journey. I want to also say that by no means am I an expert in this. What I would tell you is that you will make a ton of mistakes, and some of them will be really painful mistakes and painful learnings. But those relationships and accountability structures that you build both internally and externally in your community, as David talked about community organizing, is going to help you sustain for the marathon that is anti-racist work. So I want to thank you for giving me the opportunity to talk about something that's a little bit uncomfortable for me to talk about, because again, I'm relationship driven. So it's really about what we can build together. And so this is a really awesome opportunity. And I'm seeing some really great things pop up in the chat. And I just want to highlight, invite someone to attend URW, Undoing Racism. Starting the conversation without trying to hire more people of color isn't sufficient without broader organizational change. Thank you, Shah. Agreed. Putting people together to create a human rights county here in Westchester based on Universal Declaration of Human Rights. Right? Share recordings of this webinar, building relationships with individuals within our schools, helping find student leaders, supporting them, and adults. I love it, right? We love it. So this is inspirational, right? The other thing you have to do is we have to be able to stay positive, right? And be able to keep pushing forward when major speed bumps are thrown in our way. And so I want to thank you all for being inspirational by throwing your ideas into the chat here and creating an opportunity for us to connect. So thank you for having me, and I'll kick it back to Colleen. Go ahead, Colleen.
Yeah, thank you very much, Cindy. And the one word you didn't mention, but I think it was wrapped around everything you said, was trust. That you have to trust, you have to have trusting relationships to make progress in this journey, because it's a difficult journey. And David, I wanted to just have you speak a little bit about the practical things that Neuro has worked on in New Rochelle. And I know you've got one issue brewing right now with the famous coffee restaurant.
Oh, I wanted to talk about that. Well, you know, part of, I'll just frame this very quickly, is that one of the things that we recognize is that there's an interlocking nature of race and racism. And so within our particular city, the areas that we've been engaged and involved in have been as a result of that. So the most recent areas that we've been engaged and involved with have been around around environmental racism, particularly in relationship to linking it back to history in New Rochelle, as I mentioned earlier. And so part of our organizing efforts have been and continues to be to block Starbucks, if you will, in the city of New Rochelle from establishing a drive-through Starbucks abutting and right on top of municipal housing, as well as transitional housing, and by changing the zoning in order to make that happen. So part of our efforts, and will continue to be our efforts, are to begin to try to build our base to stop this from actually occurring. This on the books within the city of New Rochelle, there certainly are ways in which the ability to build drive-throughs in communities are limited to 1 and 2 family homes, which means once again that if you're in an apartment building, if you're in the projects, that you don't necessarily matter, because clearly that's the message that we're getting, and clearly that is part of our organizing efforts to offset. And in doing that, we have members within New Roar who have offered, and this is part of how we work as well, is that we do not just operate from a community standpoint around race and racism by only talking about what's wrong. We are invested in bringing solutions that are focused on ways in which our city, whether it's education or any other aspect within our city, is currently functioning. So we spend time engaged in that kind of work. Similarly with the police department, similarly with the Board of Ed, and I can go on and on and on and on, housing and the like, but we do not limit ourselves to that. The last thing that I want to say as a strategy, because my purpose here was to talk more about it in the context of community work and what can you do to get started. What I want to say to you is that it's really important from a community organizing standpoint within any particular community that you want to come to know and understand and be accountable to the people who live within it, is that it's important that you recognize that you're going to need to be able to dominate the public space. And what I mean by that is that a lot of decisions that occur within institutions, government or otherwise, occur within the framework of well-meaning bureaucratic intent in some instances, depending on what the outcome is for that to occur. But the public space belongs to the public. The public space is a space that one needs to recognize is yours, and is yours to be used as a vehicle in interrupting and undoing racism in the context of how it emerges within your individual communities, such as you may be in. New Rochelle is a community of 80,000 people, Black, brown, white, different religious groups, such as it is. It has a legacy or historical Black community, and it has an emerging Latinx community, all coming together, working in a particular way to try to get things done. The work is not easy. So I want to say that the tension associated with it is not easy. But if you're not able to embrace that and see that as a part of the work, in all likelihood, in our experiences, absent seeing it that way makes it much more difficult to move away from transactional work to move in a transformative vein.
Great, thank you so much. Well, this has been a terrific program, I must say. I've learned so much, even though I've been engaged in this work for a number of years myself. But I want to thank all of our speakers, Karen Norman, Dr. Iskowitz, David Peters, and Cindy Carnegie Hollins. I think our audience should realize that there's a place where you can do this work. Start with a foundational training with programs similar to the Undoing Racism Workshop, and just do it. Just get busy, whether you're in a massive organization, a nonprofit, or in your community. And I think you see some great examples today of how to do that. So thank you all, our presenters. And I know we're at the 1 o'clock hour. If there's anybody who's got a burning question, we'll take it. Otherwise, we will try to get back to you with answers if you put questions in the chat. So thank you all to your presenters. I know Dr. Iskowitz has to leave, so feel free. Thank you again for the words of wisdom, for lifting all boats, even in the area of colonoscopies. Your data really showed that when you focus on those who are in great need, that all boats lifted everybody benefits. And I think that's really the lesson of all that we've heard today. When you focus on those, the have-nots, then the haves and everybody else benefits. So thank you all. Really appreciate all that you brought to the table today. So thank you.
Thank you, Colleen.
Thank you,
You're very
Colleen.
welcome.
Thank
Thank
you,
you.
panelists. This was
Thank you very
fabulous.
much.
Thank you,
Yeah.
everybody.
Any
Wonderful,
questions in the
wonderful.
chat, we'll try to get back to you with
Thank